Drivers, medics, and other relevant stakeholders from Westnile sub-region climax with 10 days training, where they were equipped with necessary skills of responding to emergencies, such as accidents. In the training, over 30 emergency workers comprising of ambulance drivers, health workers got trained by a team of professionals from Association of Ambulance Professionals Uganda, with support from Maltese International and other partners. Tom Chobe, the president of Association of Ambulance Professionals Uganda, says the training aims at skilling the relevant emergency service providers with skills required during referrals.
We've picked all the facilities that have ambulances. And the ambulance is not an ambulance until it has the people who work in the ambulances and the equipment they use. So it is so key for us as Association of Ambulance Professionals Uganda to come here to skill the communities, specifically the people who work in the ambulance. We hope that the skills that have been attained from the 10 days we have been here will transform the emergency medical services in this region.
Honorable Alfred Okonji, the LC5 chairperson of Oro District, says the training is timely because of the increase in the demand for ambulance services in the region.
We need to know, I want to use the medical terminology, there is a surge in number of cases that need emergency. Be it on the roadside from road traffic accidents, and also the increasing number of teenage pregnancies, and the behavior of our people seeking health services very, very lately after trying traditional medicine practitioners has caused a surge, has caused a sudden increase in the need for operation of ambulance services. Am I right?
Dr. Andema Alex, the director of Oro Regional Referral Hospital, lauded the Association of Ambulance Professionals Uganda and other partners for supporting government in scaling the medical fraternity while handling emergencies.
So this is how health is managed. It cannot be managed by one person. I want to also appreciate Maltesa and also the association for making sure that the skills are imparted. I know you are much better than you came. Somebody was saying they wanted to give you another exams, you were fearing. But to me, I felt that you should now be eager to do more exams because you have been getting this knowledge for the last 9 days, I'm told. And I saw the program was so intense and so many things were taught, and you must have acquired a lot of skills. And we believe that Westnile is really energized and empowered.
Meanwhile, Bako Judith, the Assistant Resident City Commissioner in charge of Central Division Narua City, calls for responsible road usage by both ambulance drivers and other road users.
I would like to humbly request that you continue to do your community policing, especially to the Ugandans in respect to ambulance. I have seen it a common stubbornness in the region when an ambulance is going through and is even making the other alarm. You see Ugandans stubbornly not leaving road for the ambulance to pass. That I would love to see. For me, mine is commanding and ordering you to, when you go for your community policing, ensure that you pass a message that Ugandans must respect an ambulance that is passing. But also caution the ambulance that passes, that needs a passage to go through. When you're carrying an emergency, you can make that alarm and so that you maneuver your ways to rescue a life. But in situations when there are no patients in the ambulance, you also try to share the roads with us in a very good way so that we will not be able to lose lives.
While concluding with the last exercise of the training through practical session, the community along the junction connecting Mountie Road from Weatherhead Park Lane were left wondering of what emergency had taken place in the area by the presence of several ambulances and sirens that filled the air, forcing them to rush to the area to witness what was transpiring. Farish Majid, Westnile TV, Nalcast.